Welcome to the University of Calgary Health Sciences Library tutorials. This session will introduce you to using limits in a Pubmed search. While this Pubmed basic search bar can be used in a similar fashion as an internet search engine, doing some pre-work before searching anything can save you a lot of time. Many times we need to search something where the details haven't been fully teased apart. Try forming your query into a question. This will help direct your search. Once you've created your question, identify the pieces of information that are searchable. An example of this could be a PICO chart, where your P stands for your population, patient, or problem. The I stands for intervention or exposure. Your comparison may be an alternative intervention to the gold standard or might not be applicable for your question. Identifying an outcome can help you locate those studies that you are interested in reading. Having said this, however, you may not want to search for your anticipated outcome as it might not retrieve papers that have negative or alternative results. Finally, consider the level of evidence that you're looking for through publication type or study design. If you're in need of a primary study, then synthesized literature like a systematic review or meta-analysis is not going to satisfy that requirement. However, if you're looking at comparing two different drugs, for example, a systematic review or meta-analysis will be the highest level of evidence available to you. Finally, any limits that you wish to apply are added at the very end. Before we go into limits, it's important to start from library.ucalgary.ca/hsl and use the library link. Lots of scholarly material is open access, meaning free to the public, but there is still a vast amount of proprietary material. The university licenses this material for you, which is why you should use Pubmed through the library. When looking at an article, find full text by selecting the red and yellow Find It SFX button, which only appears if you use the library link. Then follow the screens. Be sure to check out print holdings before proceeding to interlibrary loan if electronic copies are unavailable. However, if both print and electronic are unavailable, you can use the interlibrary loan service at no charge. It is very efficient and you can expect quick turnaround times unless notified otherwise. Using limits can help form your research question by assisting you with your selection of studies. Inclusion criteria would be established to ensure you're getting what you need from your results. Publication date range could be included as an inclusion factor. In the same vein, if you were looking only for papers on humans, then animal trials would be excluded. While adding limits is a great way to get closer to your ideal results list, be aware that the more limits you add, the harder it is for the database to find papers that match all of your requirements. Here are some examples of limits available to you in Pubmed. We advise that you do not use age or other demographics information in the search box. Rather, use the limiters to retrieve more accurate results. While it's really tempting, do not select the Find Full Text limiter in any database at the university. If we don't have it electronically, then the next option is print. If neither are available, put in a request for interlibrary loan. It's free for U of C students, staff, and faculty, and the service is quite speedy. Now that I've discussed the concept of limits, let's try a sample search in the database. Here's our clinical question. How does duct tape compare to cryotherapy when used in pediatric patients with the common wart? Note the PICO format that I've created. For your own searches, it's a good idea to identify synonymous or like terms, as well as acronyms, brand and generic drug names, and new jargon that you would use in the clinic. So let's go live and try. So make sure that you go to library.ucalgary.ca/hsl to bring you to the Health Sciences Library page. The next thing you'll want to do is under Major Resources, select Pubmed. In our search box, let's put wart, duct tape, cryotherapy. So we only get about 15 results, but let's use our limits to narrow that down. Our patient population was pediatrics, so we will use the age limit to narrow the results list to papers in this population. On the left-hand side, you will see a selection of limits. For an extensive list, select Show Additional Filters, and then select Age. A new list will show up on the side, and then we can select Child as our age range. Note that the limit has to be selected and then checked for it to be applied. Note the check mark. From here, you can go through the list and add more limits as necessary. Since this is a therapy comparison, let's limit our publication type to systematic reviews. In the top left, select Article Types. Uncheck any other options, and let's choose Systematic Reviews. Again, we need to show, but then we need to select it again for it to apply. Note that in some cases abstracts are translated, but the paper may not be in English. So we could also select English as another filter if you'd like. Finally, the last thing that you need to be aware of in Pubmed is the search detail box in the lower right-hand side of the page. So if we scroll down, you'll see the search details box. The search details box shows the filters that Pubmed is applying behind the scenes. This concludes the tutorial on using Pubmed limits. The next time you're in Pubmed, try using the limits for precise results. For more information, or if you have any questions, please do not hesitate to contact us at library.ucalgary.ca/hsl.